Coming to organ function tests. So there are some important tests and to assess the function of organs. So collectively we call them as organ function tests. And in case of a renal function, in case of to assess the renal function, we'll do some tests. So together we call them as collectively we call all those tests as renal functional test. So renal functional tests. So here you can see there are some important tests in case of renal RFT, renal function test or kidney function test. So those are to assess the glomerular filtration, to assess the tubular function, and there are some diagnostic enzymes. So and there is routine urine analysis. So these tests are done to assess the renal function or kidney function. So to assess the glomerular function, function, we'll do some tests. So those are called as clearance tests. So what do you mean by clearance? So clearance is the amount of plasma that is cleared off a substance per unit time is called as clearance. So for example, if you take creatinine, so the amount of creatinine that is cleared off blood. So creatinine that is cleared off blood per unit time, we call it as creatinine clearance. So what is clearance? Clearance is defined as the amount of plasma that is expressed in ml, so that is cleared off a substance, whether it may be creatinine, urea, inulin, so whatever it may be, that will be cleared off a particular substance, and per unit time we call it as clearance. And the formula for clearance is so C equal to UV by P. So where C is clearance, U is the concentration of substance in milligrams per 100 ml in the urine, and V is the volume of urine per minute, and when you see the P, concentration of substance in the plasma per 100 ml. So this is about the formula which is used for the clearance test. Coming to we have different clearance tests. So those are creatinine clearance tests. So most sensitive test is creatinine clearance, and the normal values in case of the reference values for creatinine clearance is, when you see in case of males, that is 100 to 125 ml per minute, and in case of females, so it is slightly less than this range, that is 90 to 115 ml per minute in case of females. So those are the reference values of creatinine clearance in males and females. Coming to significance, so whenever the creatinine clearance is less than 75% of the reference value, then it indicates there is some renal impairment. So that is the significance of creatinine clearance. So this is the most sensitive clearance test when compared to other clearance tests, because so before the appearance of signs and symptoms of renal failure, so we can assess the effect of we can assess that renal function by using this creatinine clearance. So whenever it is less than 75% of normal value, it indicates the renal impairment. So that is the significance of creatinine clearance. Coming to creatinine level in blood, in case of males it is 0.7 to 1.4 milligrams per deciliter, and in case of males it is 0.6 to 1.2 milligrams per deciliter. So those are the values of creatinine in blood in case of males and females. Coming to another clearance test, urea clearance test. Like creatinine clearance, so urea clearance is also done to assess the function, renal function. In case of urea clearance, so here, so urea clearance will be less than the normal GFR because it is reabsorbed by the renal tubules. That's why we get the less value than the GFR, right? And when you see, so we have two types of clearance: urea clearance, maximum urea clearance, and standard urea clearance. So when the volume of urine output is 2 ml per minute, we call it as maximum urea clearance, and that is its reference range is 75 ml per minute. So whenever that clearance is volume of urine output is less than 2 ml per minute, that type of clearance we call it as standard urea clearance, and that is 54 ml per minute. And coming to significance of urea clearance, so in case of urea clearance, if the value is less than 75, if the value is less than 75% of the reference range, so we call it as there is some renal impairment. Right? We consider that value as the abnormal value, and it indicates the renal impairment. That is the significance of urea clearance. Coming to another clearance test, that is inulin clearance. So inulin is a polymer of fructose. It is a fructosan. So that fructosan is given externally. So urea and creatinine are the endogenous compounds, but it is an exogenous compound. So, and here the value of reference value of inulin clearance is 125 ml per minute. So that is equal to the normal GFR value. And as it is an extraneous compound, we have to intravenously. So this is generally avoided, and the most preferred clearance test is creatinine clearance. And test to assess the tubular function, we have specific gravity. The normal specific gravity of urine is 1.015 to 1.025. That is the normal specific gravity of urine. So generally there is decreased specific gravity whenever there is excess water intake. So whenever there is diabetic insipidus and nephritis. So in those conditions, it leads to decreased specific gravity of urine, and there is increased specific gravity of urine in case of water excess perspiration, diabetes mellitus, that leads to polyuria, and the other condition is nephrosis. So in these conditions, there is increased specific gravity. Coming to another test is concentration test. So in this concentration test, so specific gravity is measured after 12 hours of fast. Water deprivation is there. So overnight you won't take water. After that, we'll cut the urine sample, and there we'll assess the specific gravity of the sample. If it should be more than 1.022, then it indicates the normal tubular function, adequate tubular function is there, right? So that's about the concentration test. Coming to dilution test. So in case of dilution, so bladder is emptied at 7 a.m. After that, so we'll give 1200 ml of water within 30 minutes. After that, urine samples are collected for next 4 hours. So, and after collecting those samples, we'll assess the specific gravity of those samples, and one of the samples should have a specific gravity of 1.003. So then it indicates the adequate renal function. So this is about the dilution test. Coming to, so now till now we have seen the renal function test. Coming to next organ function test, liver function test. To assess the function of liver, we will do some tests. Collectively we call them as liver function tests. So there are some tests based on the excretion capacity of the liver. So we call them as excretory function tests. And synthetic function based on the synthetic capacity, we'll do some tests. Those are called test based on the synthetic function, and test based on the detoxification, test based on the diagnostic enzymes. Right? So these are some most important tests done in case of liver function. Coming to excretory function, so here we'll assess the levels of bilirubin. The normal concentration of bilirubin, total bilirubin, is 0.2 to 1 milligrams per deciliter. So in that we have unconjugated and conjugated bilirubin. The concentration of unconjugated bilirubin is 0.2 to 0.7 milligrams per deciliter, whereas conjugated bilirubin is 0.1 to 0.4 milligrams per deciliter. So this is the normal concentration of serum bilirubin. So whenever there is increased serum bilirubin, it leads to a condition called as jaundice. So whenever liver fails for any reason, whenever there is decreased excretion of bilirubin, it leads to increased bilirubin, and that leads to a condition called as jaundice. And there is a most important test done in case of estimation of bilirubin, that is called as Vandenberg test, Vandenberg reaction. So in case of Vandenberg reaction, we have three types of reaction. The serum is treated with Vandenberg reagent. So based on the result, we can classify the result into three types, that is direct reaction, indirect reaction, biphasic reaction. So in case of direct reaction, whenever you take that serum sample and react with this Vandenberg reagent, then if the color is developed within 30 seconds, we call it as direct reaction. So that indicates the presence of conjugated bilirubin. Right? And in case of indirect reaction means, so when the color develops only, color develops after 30 minutes, we call it as indirect reaction. The color is developed actually in case of direct reaction within 30 seconds. So that won't happen in case of indirect reaction because of type of bilirubin present in the serum. Right? So whenever it is unconjugated, we have to convert that into soluble form by adding the methanol. So after that only that unconjugated bilirubin gets converted into conjugated, will be converted into soluble form, then that develops the color. So this takes 30 minutes. So we call it as indirect Vandenberg reaction. Coming to biphasic, right? Whenever the sample has both conjugated and conjugated bilirubins, then when you treat with this Vandenberg reagent, we will get the color will be developed within 30 seconds. The intensity of color will be increased after adding the methanol, and that type of reaction we call it as biphasic reaction. Right. So this is about the Vandenberg reaction. So generally, in case of obstructive jaundice, we can see direct reaction. In case of prehepatic jaundice, the type of Vandenberg reaction seen is indirect reaction, and in case of hepatocellular jaundice, we will see biphasic reaction. So that's about the significance of Vandenberg reaction. And coming to urinary bilirubin, so that urinary bilirubin is seen in case of obstructive jaundice. Right? And whenever there is obstruction, it leads to failure of the excretion of bilirubin through bile. So it cannot reach the intestine, so that there is no urobilinogen. So in case of obstructive jaundice, there is no urobilinogen in the urine. And in case of obstructive jaundice, again bile salts are seen in case of urine. So that is the significance of assessment of bile salts. For the assessment of bile salts in the for the identification of bile salts in the urine, we will do Hayes test. Right? So that is for the identification of bile salts, and for the identification of bile pigments, we will do Fauchett's test. So these two tests are done to identify the bile salts and bile pigments in the urine sample. So those are the tests based on the excretory function of liver. Coming to tests based on synthetic function of liver. So liver synthesizes most of the plasma proteins. So one of the major plasma protein is albumin. So the half-life of albumin is, so liver per day it synthesizes around 12 grams of albumin, and the half-life of albumin is 20 days. And its normal concentration in the blood is 3.5 to 5 grams per deciliter. And whenever the concentration of albumin is less, and that indicates some liver abnormality, liver dysfunction is there, right? So that is one important test based on the synthetic function of liver, that is assessment of albumin levels in the blood. So coming to another protein synthesized by the liver, that is prothrombin. So whenever its half-life is 6 hours, so whenever there is whenever there is defect in the liver function, liver abnormality is there, then it leads to decreased synthesis of prothrombin. And whenever there is decreased prothrombin, and that leads to increased prothrombin time. So prolongation of prothrombin time is seen in case of hepatic disorders. So that is the significance of these two proteins estimated in case of synthetic function of liver. Coming to detoxification, so liver acts, the detoxification occurs in liver, and so we can assess when you see ammonia detoxification. The most important compound which is detoxified in the liver is ammonia. So ammonia, which is formed in the peripheral tissues in its catabolism, is a neurotoxic compound that is detoxified in the liver by converting it into urea. Right? That urea cycle occurs in the liver. So that's how we can assess the ammonia levels. Whenever the ammonia levels are more, so we can say that there is some defect in the liver function. And apart from that, drug metabolism. So for the metabolism of drugs, we require a protein called as cytochrome P450. And whenever there is defective liver abnormality is there, liver discharge there, then the detoxification, that is drug metabolism, will be affected, and also detoxification, that is ammonia detoxification, will be affected. So these two are assessed in case of detoxification function of liver. Coming to diagnostic enzymes, so there are some enzymes which are elevated in the blood in case of liver diseases. When you see in case of obstructive jaundice, the level of alkaline phosphatase is elevated. Its normal value is 40 to 125 units per liter. That is normal value. So generally, the level or concentration of alkaline phosphatase is elevated in case of uh, obstructive jaundice, not in case of hepatocellular jaundice, not in case of prehepatic jaundice, but only in case of obstructive jaundice. The concentration, the level of alkaline phosphatase is elevated in the blood. And when you see the other enzyme which is elevated in case of obstructive jaundice is GGT, gamma glutamyl transferase. So the concentration of this is also elevated, and its normal level in the blood is 10 to 30 units per liter. And apart from that, obstructive jaundice, we have another type of jaundice, hepatocellular jaundice. In case of hepatocellular jaundice, the concentration of alanine transaminase and aspartate transaminases, the two transaminases, their level is also elevated in the blood. And their normal concentration is, when you see concentration of alanine transaminase, it is 10 to 35 units per liter, and concentration of aspartate it is 8 to 20 international units AST. So that's about the diagnostic enzymes which are assessed in case of liver function tests. So thank you. So I discussed about the organ function tests, in that renal function test and liver function test.